Mr. Brady's recognized for 5 minutes.
Thank you, Mr. Chairman. There's no question. I think now a year later we can tell under the President's health care plan costs are exploding for Obamacare. Prices are up for families and businesses. Many businesses are preparing to drop their private coverage and move their workers into the exchanges at cost to taxpayers. And many other businesses are working hard to stay under the 50 employee limit. One thing that worries me is how we will treat the seniors who today are on and rely upon Medicare Advantage, a hugely popular program in my state and others. I saw on a recent White House blog that one of the staff, Nancy Ann DeParle, stated that the $200 billion in cuts to Medicare Advantage programs that was predicted to disrupt seniors' access to health care, quote, turned out to be wrong. But can you tell me what percentage of the cuts to Medicare Advantage called for under the President's health care law? How many have been implemented so far?
Well, Mr. Brady, what is not going to happen is a cut to Medicare Advantage. What is going to happen is a gradual reduction in the overpayment to Medicare Advantage, which we're being paid at about 12 to 14% more than traditional fee-to-service.
So those
Medicare
reimbursements will be cut by, according to CBO, those reimbursements will be cut for Medicare Advantage. And your actuary said that the impact would be over 7 million American seniors would lose coverage, and almost 50% of seniors would no longer be enrolling in Medicare Advantage. Is your actuary
we've seen
correct?
Just the opposite. Enrollment has increased.
Well, now wait
10%.
a minute.
We've
Madam
got
Secretary,
11 million more
when,
people,
when you
and
say
costs
it's just
are going
the
down.
opposite, isn't it true only 4% of the cuts contained in the law have been implemented, and you backfilled it recently with $6 billion of grants to these same Medicare Advantage providers? So how can you truthfully say that there hasn't been an impact when, in fact, these cuts have been delayed, I think, probably for election year gain? So how can you say that there has been no impact when the cuts haven't occurred?
Well, as you just said yourself, cuts have been, the reduction in overpayment has begun.
But they've been delayed, correct?
No, that is not true, sir. The average plan premiums are down. Last year and again this year, the bids are down for the
Medicare premiums, and I'm asking you about the cuts within the law.
Well, we are reducing the payments to companies, not to providers. We are, by law, reducing the payments, and that actually has begun to be a very successful strategy. At the same time,
but
for the first time ever...
I don't mean, I'm just trying to get the truth here. Are you saying, will you agree that according to your actuaries, only 4% of the cuts have taken place?
I assume if that's accurate.
And you've backfilled that with over $6 billion of grants to them. So when you talk
Sir,
about
we have
the
put
impact,
in place for the first time ever a quality program so that higher performing Medicare Advantage plans, so the first time, are actually receiving a quality bonus. The lower performing plans are not.
So
and beneficiaries finally have a place to make a determination.
So there are no real cuts.
No, that is not true. Sir, that's just not true.
Well, you started your testimony, your answer to me saying there's been no cuts to Medicare Advantage.
4% is what the actuary quoted. I'm agreeing with your numbers. Okay. And we are now in year 2 of strategy. What we're seeing is more plans, lower prices for beneficiaries, better quality. I think that's kind of a win-win situation.
And you'll say that, and you're saying that will continue because the $206 billion in cuts will occur in the future?
Yes, sir.
And that
I think it absolutely. We're seeing more companies. The companies are well aware of what the framework of the law is.
Now, let me just say,
not saying
your own people are saying those cuts will push 7 million American seniors off Medicare Advantage, cutting nearly half of them out of enrollment.
Sir,
so
all due deference to actuaries, they're not running the companies.
Well, these aren't my actuaries. Those are yours.
But we're seeing the companies, the insurance companies running Medicare Advantage programs coming into the market. More plans are available.
haven't occurred. Wouldn't you agree?
They know
And
exactly
you're
what
giving
the
them
framework
grants
is. I do not agree.
to stay in the
clearly.
marketplace. Mr. Chairman, I will.
Time has expired.
Thank you.